business. We are here with Graham County Economic Development Director Sophia Paulos, Graham County Manager Becky Garland, and Graham County Health Director Beth. We are here to discuss the COVID-19 crisis and all the protocols and all the steps that the county's been taking to make sure that everyone stays healthy. First, I want to go to Becky. Becky, if you want to just kind of go over the procedures. We've been starting, we've talked about the stay-at-home policy, the social distancing. I guess you and Beth both could chime in on this. But let's talk about the permits before we get into any of that. Because that's been a hot-button topic. There's been a lot of people wondering, why are certain people getting permits, why are they not? Let's kind of go into that for us.
Sure. So as of yesterday at our Emergency Management Planning Committee meeting, the committee decided to reopen the permitting process for our out-of-county property owners.
Okay.
So hopefully most of all of them who had already applied for permits received an email last night from me giving them the new protocols for getting permitted. If their permit applications are on file, we are processing those. However, we have added a new requirement so that they can be permitted, and they receive those protocols in the email as well. But those protocols state that when they enter the county, they are to self-quarantine for 14 days. They are also to report into the county that they have arrived, so we can start the clock ticking.
And how would they do that? Just call you guys?
They would call our permitting office,
Okay.
which is our tax collector's office, or they can email permits@grahamcounty.org.
Okay.
They are also to bring all their provisions with them, 14 days worth of groceries and supplies, and then they are also to provide their tag number for us to have on file. And within that is a form that they will be signing saying that they're going to agree to those provisions so that they can receive their permit.
And let's just kind of explain why we put a pause on the permits, if you wouldn't mind touching
Sure.
on that. Because to start with, everyone was permitted.
Yes.
Most everyone.
Most everybody.
Was permitted, but then we had to put a stranglehold on it. for a few
Right.
days.
We had a huge influx of applications, first of all. Probably over 600 were sent in about a 48-hour period. And knowing that our resources are limited here in Graham County for EMS, for public safety, for groceries, we felt like we needed to put a pause. And that 14-day period that we were on pause allowed those early people who came in to go through their 14-day quarantine.
Sure.
So this was our opportunity for everybody to stop and take stock, and also to ensure that the people who were coming in were well and that we had the capacity to handle them if they came in and they were sick.
Perfect. Well, speaking of quarantine, we're going to go off of that. We're going to talk to Beth for a minute. Beth, of course, the health director. Anything you want to add to this and kind of explain a little bit about the social distancing protocol, stay home? I know this is basic stuff that a lot of people may know, but maybe some people that don't really understand why we're doing what we're doing.
Sure.
Why even we're sitting up here so spread apart on the stage.
Sure. So the purpose of social distancing is COVID-19 is a respiratory illness. And just like the flu, it's spread when someone coughs or sneezes, has some kind of droplet form that exhales, anything like that. Smoking is also another big transmitter of the virus. And the biggest thing is if you are at least 6 feet away from the next person, it distances you from those droplets. So sneezes and coughs have been found to be somewhere around 5 or 6 feet. So if you're at least outside of those bounds, you run less of a risk of being exposed. So keeping your 6-foot distance keeps you well and it keeps you safe, even from the people around you. And like we're sitting here, we know all these folks, but you can also be asymptomatic and carry COVID.
And explain what asymptomatic is.
Sure.
Yeah.
Asymptomatic means you're not exhibiting any symptoms.
Right.
It's been pushed on everybody that COVID is a respiratory illness. You'll have a dry cough, you'll have a fever, you'll have shortness of breath. But in your younger population, you may have none of that. So you may find that, grandsons, granddaughters, nieces, and nephews exhibit nothing. Whereas your older population are those that are running a high risk of comorbidities. They have heart trouble, they have diabetes, they have COPD, they could potentially die from the illness. If you are sitting close to her as her grandparent, you run the risk of being exposed if she is asymptomatic.
So, anything you want to add about the stay-at-home order, though, to go with that? Because obviously you want to keep people out of the public eye, but yet you've still got people in close quarters. So is it just believed that it's to limit it and not necessarily eliminate it? Is that kind of what the philosophy is behind that?
It's to slow it.
To slow it, okay, that's a better
So,
word. Yes,
it's all about slowing the spread,
Yeah.
which obviously, if anybody's on social media or listens to the news at all, that's been really a big push, and that is because it is expected, just like the flu, that most, if not all Americans will eventually encounter COVID-19. It's just about slowing the rate at which that contact happens. So that way, when the older folks and the ones that have some kind of comorbidity are exposed, they're able to be treated properly versus having a surge at medical centers, a surge at your primary care offices, and then they're not able to get treated, at least not to the quality of care that they need because of a surge of influx. So you're always going to get exposed to your household. That's the reason they say stay at home. There is no preventing you from being exposed to your spouse or your children. They just want to make sure you're not exposed to your next door neighbor at the grocery store,
Right.
places like that.
Right. And how much, Becky, have we seen the stay-at-home order being, I'm just gonna say, being violated? Because we've had a lot of people still traversing when they shouldn't be traversing. We even put a curfew in, really, several weeks ago, from like 10 p.m. to 6 a.m.
Right.
Have we had a big uptick in people not obeying that in the county, or how's that been?
From what I'm hearing from the sheriff, most everyone is complying with the curfew order. Of course, there's always those few that want to push the limits. We've had, some unhappy folks who would like to enter the county and may not have been aware of the closure of our, highways.
Right.
Who have been quite unhappy and quite vocal about it. But for the most part, our residents are very supportive of the stay-at-home order. They're thankful for it. And many of the part-time residents that I've spoken to, they understand why we're having to do what we're doing. They're very happy we're reopening the permits.
Yes.
But my biggest concern is for any of our residents, whether they're full-time residents or part-time residents, that they, wander off to, for lack of a better term, they need to go to Walmart or Lowe's or, any of these little outlying areas of Cherokee, Swain, Jackson,
Right.
who have active cases. Because whenever we're in the grocery store, we're putting ourselves at risk. And as the case in Cherokee County pointed out last weekend, someone was symptomatic in Lowe's and could have infected a lot of people. So we're just urging folks to, I know like our local retailers, they're trying different ways to accommodate without people being in the stores. Now's the time to buy local, if you can. Just so that, and I know that's difficult because Ingles and, the stores are having some shortages. But we're also trying to put some things in place to where if shortages continue to occur or get worse, that we're gonna make sure that there's provision in the county for people. So, my counsel to everyone is stay at home. My counsel to the folks who have been trying to get permits is, we love you, we love having you with us, but we love you enough not to let you die here. And that's the message that I've given verbally to a lot of people, just because we need everyone to basically just hunker down, and just realize that this is not a week-long thing. This is for a little while. And just know that we're trying to stay out ahead of the issues so that if there are shortages or whatever the need is, that we're hoping the county can help provide or create resources for people to be able to get what they need.
And obviously, the methods are working, because I think we're down to 7 counties in the state that do not have COVID, and we're one of them.
Yes.
Kind of talking about the trend that we're seeing right now, Beth. I know I may be throwing you into something there, but as far as the statistics, I know we've had, I can't remember how many deaths statewide, but again, no cases here in the county, so is it still spreading rapidly? Is it slowing down? What are we looking at on that?
The trend is slowing.
Good.
The
That's great.
curve is flattening.
Yes. That's
The
great.
thing you're gonna start seeing now, is a uptick in the hospitalizations, which is doubling about every 2 days, and the same thing with the death rate. They were up to 131 deaths today. It was, I think, 104 yesterday. So the sick are getting sicker, which is usually the way it goes. It also shows you that only the deathly ill are being tested. People that are exhibiting mild symptoms are staying home. They're not receiving COVID testing. So the ones that are being tested are extremely sick. And that's the reason your hospitalization rates are jumping pretty quickly, your death rates are jumping pretty quickly, but your new tests are starting to curve off. And that's probably gonna be the trend you see as the government loosens some of their restrictions. You'll probably still see a little bit of an upsurge with the people that can't stand it anymore and they have to go somewhere. But hopefully it will be moderated and people will understand why the shutdown was the way it was, and still heed the warnings even as things loosen.
Well, as we know, we're in a county here, very rural, and we don't even have a hospital. We've got a couple of places here in the county, I think 3 total that you can go get tested at, if you want to mention that. And kind of tell me, should people with mild symptoms, like you mentioned, should they go get tested, do you think? I mean, is that just going to exhaust the test for the people that need it, or, I mean, what's the quantity on hand of testing here in the county?
Oh, we're doing okay.
Good.
Yeah, we're doing okay on tests. The tests that we do, we have state tests, but there's also LabCorp, which is a national company, and Quest. So we use a combination of those across the county. The turnover is looking about 3 days. So it's not too bad on how long somebody would have to quarantine if they were tested.
Right.
The recommendation is if you have mild symptoms to just stay home and quarantine. That's what you would have to do anyway.
Sure, that's what you would do if you were in a normal situation and
Exactly.
you couldn't go to work, right?
That's exactly what happens. So they're just asking if you do have mild symptoms, because at that point, if you are tested and you do test positive, you should have been quarantining yourself anyway because you were sick, and you just kind of become a statistic.
Yeah.
So, if you want to be tested because you just want to know if you have COVID-19, that's one thing. But the mild symptoms, they are recommending that you just stay home, quarantine yourself and your household until your symptoms end.
And just tell everyone, just for the record, where they can go get tested in Graham County.
Sure. The COVID testing, they offer it at Tallulah Health Center. We offer it at the health department, and they also offer it at the urgent care.
But the health department's got one special.
Yes.
Yeah.
So the stipulation for the health department, we do not have a primary care provider. So we don't have a mid-level physician like a nurse practitioner or a physician. So you have to come with the doctor's order.
Okay.
So if the person presents to Tallulah but wants to be tested with us, or they present to Erlanger and want to be tested with us, some healthcare workers have expressed the interest if they work at like Harris or Erlanger, but would like to be tested at our facility. Circumstances like that, but to be tested with us, you do have to have a physician's order.
Absolutely. Okay. Well, this has obviously affected more than just, the business. The business core has definitely been affected by it, I should say. And Sophia, let's kind of pass this over to you. The census, for starters, we're in a census year, and it's hard for people to go door to door when they're not supposed to be within 6 feet of somebody. So what steps is the census taking, and what are the numbers we're seeing in Graham County right now for that?
So one of the really unique things about the census this round is that it's the first year it's offered online.
Right.
So this year, folks have the opportunity to report either online, they can report by telephone, and if neither of those things occur, someone will be sent to your house. If you submit your census prior to that, they don't send someone to your house. I think a lot of folks are really curious as to what is so important about the census?
Right.
Why does it even matter? And there are a lot of reasons it matters, but to kind of break it down easily, one, it determines how many representatives we have. So congressional representatives on the federal level, the number that the state of North Carolina gets is determined by the size of the population. So it's important to count so that we have that federal representation. But it's also a financial issue. A lot of federal money is divvied out based on the number of people in your county. And for every individual that is not counted in the census, it costs taxpayers over $16,000 over 10 years. So if you're a household with 2 people, that's $32,000 you're going to cost the taxpayers if you don't fill it out. If you're a family of 4, you are going to cost the taxpayers $64,000 if you do not fill it out. And someone's gonna come to your house, you know? So there's a lot of movement towards that. As far as how Graham County's doing, the way they're doing the reporting is really interesting right now. The census has literally counted every single house in Graham County. And as everyone knows, we have a large track of second homeowner properties or unoccupied properties where those houses aren't primary residents. So they're not gonna be counted in the census anyway. The census started by casting a wide net and counting every single house. So when we see in the news right now that Graham County has the lowest reporting in all of North Carolina, that is not actually true.
Okay. Please explain why.
I will explain why. So that percentage is, basically they count the number of, census they need to take, the number of houses total, and the number of people total, and they divide. And right now, they're counting all the houses. So they're counting every single house, whether it's a vacation rental or not. And so that makes Graham County and counties down east, frankly, look like they're doing a horrible job responding to the census. But a lot of folks in Graham County have been working really hard on this. I know Great's worked on it. Everyone sitting on this stage has had discussions about it, how important it is. And when you take out the vacation homes and the second homes, we're actually reporting at about 44%. So we're doing really well. And at this point, I feel like we just really need to pull together and do the best we can. And instead of ultimately being reported as the county who reported the least, I would love for us to see the county that reported the most.
Sure.
Because what the census will ultimately do is they will take those vacation homes out of the number before they have a final reporting on how well we've done.
And I mean, it is so easy to do it online. I did it on my phone. Beth did it on her phone before we started recording today, and I blinked and she was finished with it. So it was a very smooth, easy process. Now talking about the Small Business Administration's loans, we kind of talked off camera about the money's gone, but there is still help out there.
There is still help.
So let's discuss that. Because obviously the business community here in Graham County has been affected by this.
Absolutely.
All these shutdowns and everything, so yeah.
So we've been emailing our business community. I mean, sometimes it's every day, and sometimes it's multiple times a day, because the information has come down so fast. It's really only been the last 2 weeks that the program was launched, and then shortly after launch today is when the Fed announced that they had run out of funding. Initially, a lot of our businesses faced significant challenges because banks were targeting specific businesses that they already had a relationship with. And they were so overwhelmed that their websites to apply were crashing. So we were really fortunate to have partners in United Community Bank. Pam Schaefer and I were back and forth a lot, and I think a lot of our businesses had an opportunity to access the application through their portal on the 2 times it opened to non-clients. And then Mountain BizWorks was able to get a grant from Dogwood Health Trust and become an SBA-backed lender for this specific type of loan because of their history being SBA lender. And with that support of Dogwood Health Trust, they were able to open it up for businesses throughout the region. And so we were able to send that both to our business owners and our churches, because a lot of folks don't know churches and can apply as well, and get that in. Unfortunately, today the program did run out of money. We are hoping that there will be additional funds that the legislature approves in the not too distant future. But in the meantime, there is a lot of support out there, and one of the pieces that Dogwood Health Trust funded for Mountain BizWorks is a free counseling session on CARES Act funding. So on PPP loans, on EIDL grants, and they're standing at the ready, eager and ready to serve Graham County. They've served a lot of businesses in Graham County, so they do have clients here. They know the county well. And they're looking forward to hearing from our business owners. And you can just go to mountainbizworks.org and click, and I'll send out an email with the update on that free service this afternoon to our business owners.
You know, and I say the business community's been affected, and it has. I'm not downplaying that, but we still have a lot of businesses still open because they're
Yes.
essential businesses. So what kind of economic impact do you project through this entire crisis? When we come out of all this, when we finally come out ahead of it and it's starting to go away, are we down, are we up because people are having to buy more in the county? What do you
I think that
about
depends on the business and the industry.
Yeah.
I think our tourism industry is obviously going to be
It's
hit
okay,
really
big hit,
hard.
yeah.
That's really clear. That's absolutely going to happen. I think our restaurants are going to see a drop just because, I mean, even we're all eating out less, we're all doing takeout less, but our restaurants have done an amazing job of adapting.
Yes.
The ability to call ahead, what, you know, Lynn's has done, for example, with offering grocery opportunities, like everyone has been so creative and innovative, and business success, economic success has always come from innovation. So I feel that, you know, our restaurants will see a dip, but they've also become really innovative and they've gotten to know their customers in a different way. I think Ingalls obviously is being radically successful. However, what's been interesting too is with that increased demand, because so many people are shopping in the county, we've seen other grocery providers show up. Lynn's is offering groceries for sale. Darnell Farms started delivering to Robbinsville. There's
Right.
twice a week you can go pick up produce and meat and cheese from Darnell Farms in the county. The Trout Farm in Almond, they've started selling trout. I got some on Friday, it's delicious. And so, like, just seeing them turn their business from a tourism-centered business to one where they're providing food for the county. I've been really proud of our folks, seeing how innovative they've been. And I think some businesses are gonna suffer really hard. Some are going to maintain or increase their sales. And it really is a matter of, one, what business are they in, but two, how innovative can they be? And fortunately, Graham County folks are innovative and they're resilient. So I'm looking forward to what comes of it.
Sure. Becky, do you want to add anything about the places people can go get food? I think we could probably mention that, you know, there's like the Manna Food Bank and opportunities like that. Just for
Yeah,
direct-
so, as a matter of fact, we've formed we're kind of jumping onto a loose coalition of
Yeah.
food providers, organizing a call probably sometime next week. We are gonna be having, or the Manna Food Bank is gonna be coming out on April the 29th, and they're gonna be doing a distribution out at the Health and Human Services building in their
Right.
parking lot. I'm really excited, I'm gonna kind of dovetail on what Sophia has talked about, is the level of innovation that we're all, for lack of a better term, being forced to dip into. You know, this crisis has shown us our strength. It's also shown us where our holes are. And so, you know, one of the things that I hope will come out of this is that we get a much better handle on the food insecurity here in the county, and that this live beyond the crisis so that we can avail ourselves. And I want to say too, you know, how proud I am of our restaurants, because no matter what, they have persevered through, and they are providing that level of service that they're able to provide. I worry about food shortage a little bit, but I do know that, you know, with this being a federally declared disaster, we've already started linking in with FEMA. So if push came to shove and you know, Manna couldn't fill some holes, and we don't ever want to step on entrepreneurship. So, you know, I'm proud of the fact that, you know, folks are stepping in. We don't want to overplay that, but we want to just fill whatever holes. And with our FEMA designation, we can do that. We can help fill the gaps. And so that's kind of our next step as we move through this process. The first month has been all about just getting things in place to protect everyone. Now it's how do we sustain and how do we thrive? Because I truly believe that as a mountain girl, we know how to survive. And we want to keep survive, but we also want to thrive in the middle of this. And so I am very positive that Graham County is going to come through this okay, and we're going to show our strength over and over again.
And we don't have Graham County School Superintendent Angie Knight here, but I want to kind of brag on the school system,
Yeah.
what they're doing
Yeah.
for the kids. Do you want to
Awesome.
mention that?
Yeah, I'm so excited about that as well,
Yeah.
that, you know, they innovated within about a 24-hour
Yeah.
period.
Pretty quick
You know,
turnaround, yeah.
Yes, they did.
That's one thing we have learned to do, is that we're learning how to think real fast on our
Yeah.
feet.
Mhm.
And they've done a tremendous job of getting the school kids fed throughout this. They turned their buses into basically, you know,
Yeah.
mini restaurants, you know, to go
Yeah.
around and do the distribution.
It's truly a Meals on Wheels thing.
It is,
Yeah,
you
yeah,
know,
for the-
Brilliant.
And something that I hadn't thought about too was, the state is in the middle of trying to transition some additional funding for our Meals on Wheels program.
Mhm.
So that instead of delivering 1 meal per day, if the funding comes through, they'll be delivering 2 meals a
That's
day.
wonderful.
So, and one other thing that we're also working on in that respect, we want to look at the holistic needs of our people,
Mhm.
not just their food insecurity, but the other needs that may arise as we're all kind of hunkered down, for lack of a better term, and that is, you know, how we can coordinate our volunteer effort, our faith-based community
Yes.
together, to create a hotline system through the senior center, where they will act as a dispatcher. So if people call in and say, I haven't been able to get to the grocery store,
Mhm.
I don't know what I'm gonna do, that we work to coordinate the volunteer efforts so that people's needs are met. You know, I think, I've said this for years, when I was just the finances officer, is that we look at things from needs versus wants.
Yes.
And Graham County has always been real good at being able to parse through those, how to prioritize, because we have few resources, but we've learned how to leverage those few resources into a whole lot of things. And the good thing is that we're a team here. Your county government is a team. We take a lot of pride. Our leading motto is "we, not me."
Mhm.
And that's what all of our departments run off of, and we're looking to help the people fill the needs. May not be able to do a whole lot about the wants right now. I want to go to Walmart.
Sure.
No,
I want to go to Walmart.
I want to go see my grandchildren.
Sure.
But I know that I need to stay home.
Yes.
And I need to stay well. And so that need needs to override the want.
Obviously, we have limited medical facilities here. What measures have been taken to sort any potential victims that might actually come back positive, should that happen? Some might be mild, some will be moderate cases, some may actually need to go to the doctor. Others, you know, they may have to get shipped off to a long-term care facility for all intents and purposes. So what measures, are there any measures in place should we get a positive test back here in Graham County?
There actually is, and
Yeah.
those come from the state level.
Okay.
So when our first positive comes back, because that's the realistic view, when our first positive comes back, the public health nurses immediately start what's called contact tracing.
Okay.
So they will contact the positive person and get a list of all close contacts. That obviously will start out with their household, but that also comes down to if they work at a hospital,
Mhm.
what floor do they work on, who is their supervisor? If they work at Ingalls, who do they work with? And then it goes to another level of, did they go to any group gatherings or any kind of drive-in services at all? Whether that drive-in service is a restaurant or whether that's a faith gathering of some
Right.
kind. And it extends farther and farther out. And they are specifically, as far as, like you said, the triaging or the sorting.
Yeah.
The triaging starts with who was their household contacts and are they at high risk? So if the household contact was a 15-year-old girl, you know, she's going to be sorted or triaged a little lower.
Right.
You know, if they live with their grandparents, they're going to want to test them.
Got it.
So if the 15-year-old stays asymptomatic, She likely will not be tested because she will be having to quarantine with the rest of her household anyway. The grandparents, or if they are a healthcare worker, or if they work in a long-term care facility, something like that, they will be tested. So that's where the triaging or sorting comes in, is into your medical risk and also where you work.
Okay, so touching on that a little bit, there was a measure at the start where they were, I wouldn't say they were required, but I guess they were required to report anyone that's underwent a test, but that's changed. Now they don't have to actually report if they go anywhere to get tested. They don't have to let you know that they tested you.
They're supposed to,
But
they don't have
they
to.
don't necessarily have to.
That's right.
But you did mention something on the call yesterday that I'd like for you to throw out there about how well everyone's been working with the health department to keep you guys apprised in the
Yes.
county about that.
Yes, they have been doing really, really well. There is a form called the PUI form, which is the person under investigation. So when somebody's tested, originally they were having to fill out that complete form. As they move to what's called mitigation strategy, so in other words, these closures and, lessening the number of people that can congregate, those are all mitigation strategies. So when they moved to those, they were telling healthcare providers, you don't have to complete that form anymore.
Okay.
And so our healthcare providers have been really good about still completing that form and sending it to us, but they also understand that while Graham County might not be a border county, we are sort of a border county. So we've gotten results from Union General
Okay.
in Georgia.
Right, in Blairsville, right?
In Blairsville.
Yes.
We know folks are getting tested in South Carolina. So to expect our count to be perfect is not rational.
Right.
We know that our count is probably higher than that. They are required to always report their positives to us. So while our count right now today is 100 tests, we likely think it's a lot more than that, but there is still no positives. So yes, they are not required to complete all the forms anymore, but our guys are really good about it.
Yeah.
So we're not
Which is
all that
great.
concerned, it's
Yeah.
fantastic. But like I said, with us being so close to neighboring states, it's a little unrealistic to think 100 is, right.
All that's been tested.
Absolutely.
And that 100 you're talking about is Graham County residents, or they have, even if they're not actually in the county right now.
Correct.
But it still comes back through the system. Kind of explain that to me. That's been a hot button topic on Facebook too, is the way everything's been reported. Like the first case, I think, in Cherokee County was someone from New York, Pennsylvania, New Jersey, one of the northern states, I can't remember right now. But they came down for like a visit to the John C. Campbell Folk School, and they ended up with it. Now, they quarantined themselves in Cherokee County, but they were counted from their home base. To kind of explain where they came up with that system, because I know a lot of people have been asking that.
Absolutely. So, the reason that occurs the way it occurs is sort of like the census.
Yeah.
Honestly.
That's exactly right.
That's exactly the way it works.
Collects
Yeah.
data.
It's only to be counted once.
Yeah.
So, that's why it's occurred the way it's occurred. And it really gets down to your basic, like Clay County right now, they have somebody that works in Clay County that lives in Georgia.
Right.
So that's what we're gonna start encountering a lot of, is if we have someone, for instance, that tests positive somewhere down the road that works at Harris, or works at Erlanger.
Yeah.
To expect your county resident to test positive and reside and work in the county is not really realistic.
Right.
So, but the health departments have done a really good job of pretty open lines of communication. And even, like you said, with the ones that are being tested at Mission, or they're being tested at Harris or Erlanger, they're really good about getting us those forms. The Cherokee Hospital has been excellent to work with on getting those forms, because obviously we've got some tribal folks that live in Graham County, but they go to, on the reservation for their services and things like that, so, which of course is in Swain County. So, it really all depends, but yeah, that's the simplest thing, is it works like the census. You only get counted one time.
Right. Tax relief for non-residential property owners. Some of these people that have been denied access to the county and haven't been able to get up here, there's been a lot of, I'm gonna call it, dismay over that. They're kind of wondering if, they're paying their taxes to have a house up here, are there any plans since they wouldn't be able to get to their house up here?
Not really.
Okay.
because, first of all, we have to tax everybody equally. So if if the county, under the North Carolina General Statutes,
Right.
under the Machinery Act, which is 105, if you want to read it, it's about that big.
Yeah,
They say that, you know, that we have to tax equitably. And so if we were to forgive taxes on one side, it would be difficult not to do it for the entire county. This is a very big hot button issue. But the deal is that under the North Carolina General Statutes, 166A-19.31, I have memorized that.
people will research it too, they'll look that up.
When we are under a state of emergency, which under our emergency ordinance, the county can issue a state of emergency. We can limit access to property. We can limit ingress, egress, in and out of the county. And it's not something we've enjoyed doing.
No, I'm sure of that. Yeah.
Not at all. But we knew that we had to do what we needed to do to keep people safe.
Sure.
Similarly, when the governor issues his executive orders, and he told us that we couldn't go get our hair done, or he told us that we needed to limit our access. You know, the most recent order, I think, was to limit the number of people that are going into retailers.
Yes.
Based on square footage.
Right.
That is not a comfortable thing, you know, because I want to say, well, I have the right under the Constitution to go anywhere I please, that I have the liberty to move around at will. However, under North Carolina state law, the governor can limit those things, and the Board of Commissioners can do those things as well.
He can give the local government the authority to do it.
Right, because we are, as a county, we are a subdivision of the state. We fall under what they call Dillon's rule, which says that we're just an arm of the state. But I can't, it's like I've told some folks on the phone, talked to many people. I've got to know many people. And I want to say this, the people I've talked with have been courteous for the most part, and they've not been happy, but I've been as unhappy as they have to say, no, we can't allow you to come into the county. The reason that we've had to do what we've had to do is to protect people's health.
Yes.
And under the state of emergency, we are under war. We are basically at war with an invisible enemy. And that dictates, for lack of a better term, that we do everything within our power as a county to protect the health and welfare and well-being of the people. So it's not a pleasant thing for us to say, no, you cannot access your property. But it's also not a pleasant thing when we only have 2 ambulances in the county. And if one of those ambulances, or both of those ambulances, are out of the county, and for instance, someone wrecks, we haven't protected their health and well-being very well if we have not restricted movement during this crisis. And we also know that under the best of circumstances, we're 40 minutes away from just a critical access hospital.
Right.
There is an ICU in Murphy, but they have very limited ICU beds and very limited resources to ventilators. And so it goes back again to, no, we're not going to allow you to have access to your property that you pay property taxes for. But our mission as a county government is to protect the health and well-being of our residents, full year residents and part year residents. And we are doing everything in our power to protect folks.
And I think that now that you guys decided to open back up the permit process, I think that'll ease a lot of this, but you know,
Right.
still people are gonna be asking.
Right.
Yeah.
But again, it goes back to what our core mission is.
Sure.
And what our our capacity is. And, unfortunately, we don't have the capacity, to have enough of an ambulance service to serve a big swell in the population all at once. And we only have specific resources that we can utilize. And I get that all day. I understand where they're coming from, and I sympathize with them. But at the same time, we have to make hard choices, unfortunately, when you're running a government. And this was one of those hard choices that had to be made.
Well, with all this staying at home business and people maybe needing to, work from home, telecommute, I think is the term you would use for that. That leads me to something, Sophia. The internet structure in this county is leaves a lot to be desired, I guess.
It leaves a lot.
But a lot of this stuff did not occur in time for this, and now you've got a lot of people trying to tap into an already limited resource. I think it's suffice to say this has kind of sped up the process a little bit, hasn't it, as far as trying to get that push into this county?
Absolutely. Absolutely. I think I've been saying for years, this is, broadband is the next electricity.
Yeah.
The Appalachian Regional Commission, or ARC, was founded to bring electricity to the Appalachian region. That's literally how that organization started. And broadband's that next thing. We have noticed a decrease in speeds at times, I think, around the county because there are so many people on the internet right now. But the good news is it's getting attention like it never has before. I think for the first time since I've been working on broadband, we're seeing federal agencies and officials and state officials who weren't necessarily paying enough attention. Not our representatives have done a great job at that, but other representatives at the state level, they're beginning to see how absolutely imperative it is. Like internet is an essential service. It is no longer a luxury. And I think that this situation has made that really apparent. But what is being done about that? The good news is we did have 2 companies apply for state level grant grants. And we're hoping to hear really positive feedback on that note. I'm praying one of them gets funded and that the second one will get funded the next round. Of course, that's not in time, as you noted. However, we've had a lot of really good support from regional efforts, and back to Angie Knight, she secured 10 wireless hotspots through Dogwood Health Trust, and right now they're working on the logistics of where in the county is that going to be, where are they going to be located, how is that going to parse out, but it has been funded, and the work on that's underway. So there will be 10 hotspots around the county for folks to use, whether you need to do it for work or you need to access it for your children's school. And right now we have 3 public Wi-Fi hotspots in the county. So you can go to the courthouse and be outside your vehicle and use a public Wi-Fi spot there. Socoa Valley Center has actually 2 Wi-Fi hotspots that you can, again, pull into their parking lot and access. There's no passwords required for either of these. And then the Graham County Library, I believe it's from 8 a.m. to 10 p.m. It's the very same thing. You can go into the parking lot and access public Wi-Fi. So those are the 3 locations that are active now. And as soon as those 10 Wi-Fi spots, compliments of Dogwood Health Trust, thank you guys, that as soon as we know about those and where they're going to be, I am sure you'll be the first to know and tell everybody about.
Oh, you darn right. Front page, 6 columns across the front. Anything else you guys want to add that we haven't touched on yet?
I want to talk about something that Chris Weatherford, our DSS director, has had on his mind and heart.
It may be something that I heard on the phone Tuesday night, but you go right ahead.
It goes back to the food issue. The state has been really proactive in this process of helping with our FNS services, which is food and nutrition services. And I believe that Chris put in the paper this week, he had a really nice letter on display about that. And I want to point out that a couple of the things that he's related in that that is, first of all, if we get a certain percentage of FNS recipients in Graham County, every school kid in Graham County will qualify for a free and reduced lunch.
Right.
Okay, so, even if our folks apply and they just get $10 a week, that's gonna multiply, especially if they're a family, that's gonna multiply itself exponentially as far as how much that family is spending out on school lunches. I remember almost going bankrupt on school lunches when my kids were kids because of my son. I remember getting a bill from the elementary school at the end of the school year, and I nearly died because I kept going back for more.
But you're gonna charge each time.
Yes, I do, and it's expensive, you know. But that $10 again will leverage itself into many, many dollars back into the household budget.
That's correct.
And second of all, we mountain people, we don't like to ask for help. We've got a big, wide Independence Street.
You wouldn't say we're a little bit stubborn about it.
We have, I would say we're Scots Irish, and we got a big, wide Independence Street.
Yes.
Okay? But I want to say this, there is no disgrace in going and filling out that, or calling into DSS and filling out that application. Because first of all, we're hardworking people, and we pay our taxes. And we take pride in paying our taxes. And that is a return on your investment that you're making into the federal government. So it helps our school system, it helps our families, and it underscores that government can work for us, and that government's not always there to take. It can give and it can provide. So I want to recommend and I want to urge our citizens here to, let's make an investment in our community by reaching out to DSS during this time. And even if you just get an EBT card for $10, you have leveraged, you've helped us leverage a lot of money to come into this county. We contribute to the federal government, and now they need to make an investment in us. So let's get those applications in.
Anything else, Sophia, Beth?
I'll add, on the unemployment note, I'm glad you brought that subject up, Becky. A lot of folks have questions about unemployment. It's gone up a lot in North Carolina. I believe on a national level, we're nearing 18%, which is a very scary high number.
Yes.
In North Carolina, however, our legislature and our governor worked really hard to modify unemployment benefits under this current circumstance. So before, you would have to, you'd have to wait a week before you could apply at all. You no longer have to wait a week, you can apply right away. You would have to go for an in-person interview. You no longer have to do an in-person interview, someone will call you. And it used to be that you would have to continue to look for employment while you were on unemployment. That has also been changed for two reasons. One, we want you to stay at home.
Exactly.
But more importantly, one of the things we face in North Carolina is actually a workforce shortage in normal times. So, the governor and our state representatives, one of them being Kevin Corbin, were really concerned about people being able to return to the jobs that they had. So that our business owners didn't have a workforce crisis coming out of this. So that's part of the reason that provision is there. I get a lot of questions about the $600. There's a lot of word, the federal government's gonna add $600 to your unemployment, and we're gonna do it until September, I think it is. And there are a lot of questions like, when is that going to hit my unemployment check? And the answer is, we don't know. The state is still waiting to hear from the federal government how that's going to be rolled out. But the money was appropriated in the CARES Act. However, there has been no guidance from the federal government on when and how that's going to roll out. However, it will be retroactive. So from the time you start unemployment, from the time it's approved until the end, you're going to get that extra $600 every time. So don't be discouraged. If it's not there already, it will come at some point, and ultimately, no matter what happens, you will get all of the money you're owed under that program at some point.
Wonderful.
And I do know that we've had to furlough some employees with this crisis, and I do know that it is beginning to pop. It is beginning to filter its way down. We've had a couple of our
Oh,
folks
good, okay.
receive their
This
back
is the
pay.
week for that.
Yeah, yeah.
Was that state back pay or federal?
It was the federal.
Okay, good.
Yeah, so that is beginning to come down, but it's slowly making its way into the local.
Sort of like these stimulus checks that we all.
Right, so it's like, please
Yeah.
don't be discouraged, like, please, if if you have been laid off or let go from your job as a result of this matter, go call NC Works, they will help you. The state website, ncdes.gov, I believe, is the employment website. Call and stay on hold until you get somebody, get the website, if you gotta do it online, try to do it like late in the morning or really late at night when there's less likely to be people on it. But don't get discouraged, like, it is there, the money is yours. It's like Becky said, like, you put tax money into the system over and over again, and this is just, you getting a bit of a refund in the form of unemployment or the form of food and nutrition services. And don't get discouraged, because it is coming.
Don't get discouraged. I think we can also say that this entire conversation is centered around don't get discouraged.
Exactly.
I mean, there's a lot of doubt in the world right now, and we don't know when this is all gonna end, but we do hope that we've answered most of your questions. I know it's probably impossible for us to even sit here the rest of the evening and brainstorm other questions that we could probably answer, but we want to thank you guys for joining us.